what we're going to do first is to talk about the comprehensive eye exam and the fact that it was used to save Ruby, I think it is, the mother of Ruby, an 8-year-old Atlanta girl who developed a tumor of her eye nerve, which is, of course, something very important. Luckily, the tumor was safely removed. But Ruby Mosqueda's story highlights just how important it is for children to have a yearly eye exam in order to detect any problems which might exist. So, Dr. Thau, how common are vision problems in children?
It's estimated that 1 in 4 children has a vision problem, and most of those are undiagnosed. Children don't realize that they have vision problems. They assume however they see is normal. And relying on vision screenings can give you a false sense of security because it does not thoroughly assess all of the different aspects of vision, nor does it diagnose or provide treatment. That's why a comprehensive eye examination by a doctor of optometry is critically important to ensure that our children have the opportunity to not only develop good vision, but to succeed in school and in life.
All right, so how often should the exam be done?
So as past president of the American Optometric Association, I'm thrilled to announce that we have new clinical practice guidelines for pediatrics in which there are new recommendations for the frequency of those comprehensive eye examinations. According to the guidelines, the recommendations are that children should start having their first comprehensive eye examination with a doctor of optometry in the first year of life between 6 and 12 months of age, then again between ages 3 and 5, and then annually throughout their school years. And the reason for that is that children are not born with their visual system fully developed. It has to develop over time. And we need to ensure that the visual system is developing appropriately and that it's able to meet or exceed the increasing demands that the child has as they age. Vision is not stagnant, it changes. And that's why children need to have those comprehensive eye examinations with their doctor of optometry.
All right, I meant to mention also in introducing you to my Health Power audience that you are a past president of the American Optometric Association.
Yes, thank you, I am.
And you say the first exam should be done during the first year and then at ages 3 to 5?
Correct. So the first exam is really critical in that first year of life because there are a lot of changes that take place in vision, and you want to make sure that that child's visual system is developing on track. The American Optometric Association has a national public health program called Infant C. We provide the first...
I'm sorry, give me that name, Infant C?
Infant C, that's Infant, S-E-E, and through that program we offer no-cost vision assessments for every baby in this country one time in the first year of life. You can find a provider that participates in the program by going to infantc.org, that's infantsee.org, or by going to the American Optometric Association's website, AOA.org. We have a doctor locator there where you can find a doctor of optometry in your area and find one that participates in the infancy program.
I see. Okay. Just so that we're sure everybody has that. There are two different websites. One is infantsee.org, and the other one is AOA.org.
That's correct.
Okay. Thank you very much. And tell me now about the guideline. We've talked about the guideline during the first year and then during years 3 to 5. Why is this so important?
Because our visual abilities impact development in a lot of areas. Vision impacts the intellectual development, social development, and motor development. A child that has trouble with their vision will not be able to achieve in school as well as they should. Children with vision problems will often exhibit behavioral issues in school. They'll often have trouble reading or avoid close activities. But by implementing the proper vision treatments that are necessary, that child can achieve greatness. I've had children that I've examined who came in being labeled as learning disabled, that were not reading well, were after the right glasses or contacts or vision therapy, in the matter of weeks, went from reading in the 3rd percentile to reading in the 85th percentile. I certainly didn't teach them to read, but I did give them the tools to be able to learn. And an eye examination can often change a child's life, but sometimes it can actually even save a child's life, because eye examinations do more than just check for clarity. They check for focusing, tracking, and eye coordination. They check for how the information is processed, all critical things for learning. But in addition, when we perform a comprehensive eye examination, we thoroughly assess the patient's eye health, which includes being able to visualize the arteries and veins, the only part of the body where they're visible without cutting someone open, which allows us to look for systemic health problems like high blood pressure and diabetes. In 2014, my colleagues found 240,000 new cases that were previously undetected of diabetes based on an eye examination. And when we examine an eye health, we also see the optic nerve, which is an extension of the brain, one of the 12 cranial nerves. And the visual system impacts many different regions in the brain. The brain dedicates more space to vision than it does to any of the other senses. So we also can find all kinds of neurological problems like brain tumors, aneurysms, strokes, and multiple sclerosis.
Now, Maria, tell us about your daughter's story.
Yes, so Ruby was actually born premature, and it was suggested for her to see an optometrist at 3 months of age, and every year since then to check on development. So Ruby in 2015, she started having a lot of symptoms of headaches, and she would wake up at night screaming and crying, and she was very, very upset about it, and we were very scared because it's not normal for a child of 7 years to have so many reoccurring headaches. So we did take her to the ER, and they told us she was okay. She passed all the neuro tests. Then we were referred to other specialists who also told us that it were possibly migraines, and she was medicated, and it didn't help since that was not what was really causing the headaches. We took Ruby to her eye appointment that was coming up the following year of 2016, where she was still having these headaches, and she had to come home many times from school due to those headaches. So we took her into the eye doctor, and we've known this eye doctor for a while now. So she asked me how everything was going, how Ruby was doing in school, and I told her everything that was really going on, and not knowing that she would be the person to help us the most. She dilated Ruby's eyes, and through that she found that her optic nerve was swollen and causing a lot of pressure, which she told me was the cause of her headaches, and told us we needed to take her to the ER because it was a very serious problem that turned out to be a brain tumor, which was very scary for us. But just as Dr. Thau was saying, that children need to go every year, even with children who do go every year, as our daughter Ruby, it's very important not to skip one of those years, because had we skipped our eye appointment, we probably wouldn't have Ruby today, and that would just be the worst.
And they were able to successfully remove the tumor?
Yes, most of it was successfully removed. She did have radiation therapy, and is still right now stable.
I see. Okay, well, that's very good to know. And as you say, it's very good that you were careful and pursued having the necessary examinations until you found out what the problem was.
It was.
Dr. Thau, how can parents protect their child's vision? I guess it's by following the new guidelines you mentioned?
Exactly. By following the new guidelines, having your child receive that comprehensive eye examination by the doctor of optometry is the most important thing to do. And that doctor will make all kinds of recommendations, including ultraviolet protection for children's eyes from the sun, recommending that the child play more sports outdoors, which is associated with improved vision, by following the American Optometric Association's 20-20-20 rule, which is to take a 20-second rest break after 20 minutes of close work by looking at something 20 feet away, by not holding handheld devices and books too close, and by, again, making sure the child engages in sports and outdoors activities. Your doctor of optometry is poised to ensure that your child develops the best vision possible and is able to achieve greatness in life.
Well, that was very helpful. Those guidelines are very helpful to us, and I'm sure our Health Power audience will appreciate learning about this. Let me thank both of you for participating in this discussion, and I'm confident that it will be very helpful.
Thank you for allowing us to share our message, and please don't forget to go to our website at aoa.org for further information.
Thank you so much.